So when it comes to prostate cancer, are there early warning signs? I mean, you mentioned the symptoms are hard to determine.
Well, that really hits the key of this debate of what is prostate cancer. You see, you're asking the question as if prostate cancer, as most cancers, and I'll answer it that way first, so I don't get this too belabored. Most cancers are discovered when they've already spread to the body. They're stage 4. So stage 4 prostate cancer gives you these types of symptoms. You would get first, what normally would happen is the man would start to feel some lower back pain. And then they would go to the doctor and they'd say, oh, you're just getting old, it's arthritis. Then it would start to go to the hip. Oh, you're even getting older now, you have worse arthritis. Then the wife starts yelling at him because he's not taking the trash out, he's not doing his fair share, and he's looking pale, he has no energy. Again, doctor would say, oh, you're just getting old. Well, what's happening is this cancer would start to spread from the prostate, it spreads to the lower back, the sacrum. Then it moves its way up the lumbar, hence the pain, and then into the ischial tuberosities, which are the hip bones. And every time it does that, it gets into a larger part of bone marrow. It eats up the bone marrow, and for food, it just loves it. It's like a kid in a candy store. But by doing so, you lose red blood cells. And you lose red blood cells, you become anemic, and you lose energy. So that's really how this would progress for a lot of men. But still, doctors couldn't tell what was causing it. They kind of knew it was not good. But then one day, patient goes to the bathroom and he pees blood. That tended to be the nail in the coffin about what the problem was. So that's how this thing progressed typically. That's the level of what you hear about with other types of cancers. The thing with prostate cancer is, because of the PSA that we discussed earlier, and it has so many false leads, and it's leading to all these overdiagnoses of prostate cancers that are not the kind to kill you. As you probably know, most prostate cancer does not kill you. So most of them are poodles. The problem is some of them are a pit bull, and we don't know which ones they are. But if you have a poodle form, then the question, turning it around again on you, is, well, how do you know you have a poodle form? You don't. That's the problem. It just hangs out. It hangs out. You may not know you have it. The rest of your life you may not know. And statistically, most men have these cancers and never know they died with it.